The Minister of Health and Social Welfare, Professor Mohammed Pate, says rehabilitation of workforce and services will be strengthened to achieve universal health coverage and reduce brain drain in the health sector. Pate, represented by Director Regulatory Bodies and Professional Schools Division, FMOH, said this at the two-day stakeholders meeting in Abuja.
The government is not unaware of the phenomenon as it affects the entire healthcare workforce. The Japa syndrome, that is already been mentioned, has assumed an alarming trend in physiotherapy, where Nigerians with relevant qualifications are continuously attracted abroad. Many medical tourists have come to give accounts of the rehabilitation services they received abroad at exorbitant costs. You can be rest assured that the healthcare system will be turned around in Nigeria in no distant time with what the government of the day has begun. No time for details. This gathering represents an important step in the implementation of the Rehabilitation 2030 Agenda Initiative, which envisions that every citizen should be able to meet his or her rehabilitation needs. Your gathering today is a milestone for Nigeria in fulfilling its mandate to transform healthcare service delivery to assume universal health coverage.
Professor Rufai Ahmed, Registrar and Chief Executive Officer of MRTB, had this to say.
So we are coming here to meet with stakeholders to discuss how to initiate the process of the rehabilitation from the perspective of practice, regulation, and training. However, having all those stakeholders will also give the opportunity for us to be able to begin to discuss those matters that will require other stakeholders' attention, so that we can be able to have this implementation of the Rehabilitation 2030 agenda.
In his remarks, Professor Philip Abiodun, Chairman of the National Tertiary Health Standard Institution Standard Committee, said the committee would provide support to ensure full implementation of the policies to strengthen rehabilitation services.
Because you plan to set standards, and we shall be very happy to have these standards from you so that we can incorporate it and come and monitor it. I can assure you of our full cooperation. The WHO 2030, let me say, vision should not just be paperwork or rhetoric, but with what you are going to do today, it's not just talk, but do. I'm very convinced that we are moving forward and that Nigeria has the vibrant people to move this nation forward.
It has a great capacity to regulate, to train, and I'd like to assure you that the vast assets available to the NUC will be deployed to you as we partner together in developing a strategic plan to improve on this aspect. This will include the areas of academic content, rehabilitation and medicine. It will also include accreditations and curriculum development and review for first degree and higher degrees. It will also include pedagogy, mentoring, monitoring, and evaluation of programs. And so I'd like to assure you that we are ready to support and partner with you.
The theme of the meeting, organized by the Medical Rehabilitation Therapist Registration Board of Nigeria, is Implementation of Rehabilitation 2030 Agenda in Nigeria, Training, Practice and Regulation. Stakeholders from the academia, regulatory bodies and ministries, departments and agencies were present at the event.